Hello and welcome to Rajya Sabha Television. I'm Vishal Dahiya and you're watching our special show, India Fights Back vis-a-vis a COVID-19 pandemic. Now, today we're going to talk about the vaccination protocol. Recently, 2 vaccine candidates have been given emergency use authorization by DCGI, and the Health Ministry has now said that they're ready to roll out the vaccination process within 10 days, although the final call will be taken very soon. If you remember, a large-scale dry run was also conducted in all states and union territories on 2nd of January with an objective to test operational feasibility of the use of a co-win platform as well as other aspects related to the rollout. So today we're going to talk about all aspects of vaccination protocol, how it will be done, what are different areas which need to be focused upon, and what exactly is the process and who all will be covered. For more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with Professor Y.K. Gupta is with us. He is the president of AIIMS Bhopal. We also have with us Mr. K. Bhaskar. He is Commissioner, Health and Family Welfare and Mission Director, National Health Mission in the Government of Andhra Pradesh. We also have with us Sushmi Dey, the Assistant Editor of the National Bureau of Times of India. Also with us, she looks after the health department there. Let me begin with you, Professor Gupta, and let's start by understanding the vaccination protocol as far as COVID-19 is concerned. The 2 vaccines vaccine candidates which have been given emergency use authorization. Once the process of vaccination starts, what are the various formalities involved as far as finalization of those who will get the vaccine, and how will the entire process move ahead?
Thank you very much. And I must say that before I give you the understanding of the protocol, I would say pre-protocol essentiality. That is, no person in the country should be undue apprehensive about the safety and efficacy of the vaccine which have been approved on emergency use authorization. So that is the first message I would like to give to the public in India. These have been approved under emergency use authorization after due consideration by the subject expert committee and examined by regulator, based on the potential benefit versus potential risk, and when this overweighs much higher than the benefit is much more, and there is a negligible or acceptable risk, that is why there should not be any fear about the safety and efficacy. And because there have been a lot of people are giving expression or have expressed the apprehension, therefore there should not be vaccine hesitancy unnecessarily. That is the first thing. Now, the second thing is, we must understand that vaccination to the entire population of this country, 138 crore population, is a mammoth task. Never ever before, such a large scale operation has been done. This requires a policy, strategy, and absolute coordination and oversight. And for that, we know that initially we will, even if we get all the possible doses, we cannot bombard all the vaccines at one shot, because it will require the huge number of syringes, needle, vials, transportation from storage to the end stage, and therefore it has been prioritized. And how it has been prioritized by the government of India is that first prioritization is the healthcare worker. And healthcare worker means because they are the people who will be most likely to be affected most exposure, and this will be including doctors, resident nurses, like that, and this will be nearly 1 crore of the population, so they will be the first. And after that, the next would be front line people or healthcare workers, and the front line, that means the frontline workers including personnel from state and central police department, armed forces, and home guards, civil defense organization, disaster management volunteers, and municipal workers. So these are the called as front line workers. So
Okay.
they will be the second priority, and this will be approximately 27 crore population which will get it. And the next would be the people which has a higher risk, and that is people with the 50 years of age, more than that, and with some comorbid factors, maybe diabetes, maybe hypertension, cardiovascular disease, the cancer, or you can say where there is a possibility of immunocompromised state,
Okay.
and including much more age. After that, those who are left, and they will be taken at the later stage. So this prioritization does not mean that any person is not, that rest of them are immune. They also desire, but this is how the prioritization is done because of the purely logistic reason, and purely because those who are more needy because of the possibility of the infection high, then
Okay.
they will get it. So that is one. And I will maybe you can later
Okay, okay, definitely.
cover that.
We'll come back to other aspects as well, and we'll try and understand, the concept of having that app platform, CoWIN, and how, that will be utilized. But before that, let me bring in Mr. K. Bhaskar here as well. Mr. Bhaskar, since, you've been handling the entire COVID situation as far as the state of Andhra Pradesh is concerned, along with your colleagues, there was a dry run as well. The question which I have for you is, how prepared are the various state machineries as far as this, this process of vaccination as detailed out by Professor Gupta is concerned? In stages, first will be the prioritized groups. So how prepared are you guys?
Thank you, Mr. Dahiya. So, first, let us make it very clear that vaccination is not new to us. In fact, India does the largest vaccination program anywhere in the world. There is a well-oiled machinery available. In fact, on the 17th, we have a pulse polio vaccination program from around 40,000 locations in one state of Andhra Pradesh. We'll be vaccinating, lakhs of children. And COVID vaccine would be a minute fraction of it, at least in the first phase that we are going to handle.
Okay.
As Professor Yogendra Gupta sir has indicated, so the first priority healthcare workers in our state, the number is just 3.7 lakhs. So if 3.7 lakhs doses of vaccines are made available to us, it is just a matter of 2 days for us to vaccinate the 3.7 lakhs population. In fact, we would be operating less than the 37,000 vaccinating sites that we have today, because in this we'll be using only part of the vaccinators which we have, because the numbers are low. And if more vaccines are made available, that is the second priority group of other frontline workers, who are around about 7 lakhs in my state. So 3.6 lakhs are the healthcare frontline workers, and there are 7 lakhs other frontline workers belonging to basically police and other related security forces, as well as the municipal sanitation workers. And now Government of India has also included revenue department officials as part of the frontline department. So round about 10 lakhs would be the total frontline workers. So that I think would be very comfortably be able to do if the enough number of vials available, we'll be able to handle it quite easily. And the app or the portal that we are talking about, or the IT platform that we are talking about, is also not something which is new. We have been using it for some time. Only thing is that for COVID management, it has been modified to an extent that earlier we didn't have these layers of identity checking and people applying for registering for vaccine. Such kind of different flavors were not there in the IT platform. Now we have these flavors added because there is an element of checking identity, an element of including one's name by prior registration. Such kind of modules are new, But otherwise, our vaccine management module was well up and running. And also, we have a very well-established cold chain system where, in that, every state has a state cold chain system where large warehouses are there where temperature could be maintained in the temperature ranges that has been suggested to us between 2 and 8 degrees.
Okay.
We have distributed warehouses. We have warehouses even at the facilities like every public health centers, urban health centers, and all kinds of health facilities also have facilities for storing both vaccines as well as other paraphernalia like syringes, even to the minute thing that the garbage that we generate also has to be collected, stored, and then disposed in a proper manner. Everything has been worked out, and this is not something new. The only thing is that the volumes are going to be higher. Since the volumes are going to be higher, probably this will be going on for certain longish period of time. As and more vaccine vials are being made available to the states and the district authorities, I think we will be able to handle these huge numbers. That should not be a problem. Purely from a management perspective, let us assure that this is nothing new. We have done it in the past. Only thing is this is a little higher numbers, but I think I'm confident that all the states and union territories would be able to handle this at a very comfortable pace and comfortable manner.
Okay. That's quite reassuring to hear, Mr. Bhaskar, specifically coming in from the ground, from those people who have to, ensure that this entire campaign of vaccination does get on the road and gets completed as well. That brings me to Shushmi here. Shushmi, since you've been keeping a close watch on all the developments, specifically, the question here arises is that how would you look at, in terms of the protocols for the entire vaccination programs and the preparations there as well? In your viewpoint, where do we stand? Because as we understand from Mr. Bhaskar, on the ground, it looks like people are very confident. It's something which is not new. There have been vaccination programs earlier as well. And there is a detailed process which has been laid down by experts like Professor Gupta there.
Yes, Vishal. Once the vaccine is approved for emergency use, the government has to, and the whole machinery has to ensure that each and everything is in place. All the nitty-gritties are taken care of. And like the two experts have already pointed out, fortunately in India, the government already runs the world's largest, possibly the largest immunization program, which includes children and pregnant women. So, to a large extent, there is preparation already on the ground, and it is enhancement of that system which is already there in place, which includes cold chains, which includes vaccinators, which includes temperature management, as well as a very important thing which has helped India also is the vaccine manufacturing itself. So, I would like to highlight that the two vaccines that are being that are going to be used in India, or which has got approval, we still do not know whether both of them are going to be rolled out at once or only one is going to be. What we hear from our sources is possibly it will be one by one, but it can be simultaneous also. So the point is that both of these vaccines are being manufactured in India. That makes it easier for the country to manage the supply or to initiate the supplies, because logistically also, if you have a manufacturing facility based in your own country, it is easier to transport the vaccine. So now that the vaccine has been approved and the government has been telling us, and today it said it on record, that the health ministry is prepared to roll out the vaccine within 10 days from the approval. So which means on Sunday we heard about the announcement. Around 13th, we are probably going to see the rollout. That's what the government is prepared. Maybe there can be a day or two here and there, depending on what is decided at the highest level of the government. So once the vaccine is now rolls out, the whole process starts from the manufacturer. The manufacturer will actually have to air transport it to four, I think Dr. Gupta will correct me if I'm wrong. There are four depots which are there in Karnal, Calcutta, Chennai, and Mumbai. Mumbai. So these four depots, the vaccines will be transported by the manufacturer to these depots, and from there they will be transported through refrigerated vehicles to state level vaccine stores, which are around 37 we have across the country. And from there, the state government or the UT government take it on, and they supply it further to PHCs, to district levels, to district hospitals, to sub centers, and through this whole complete chain involves around 29,000 cold chain points, which were most of them were already functioning, because of the huge immunization program that is being run in the country. And a lot of it has been is being added. Similarly, in terms of vaccinators, we are told by the government that there are over 1 lakh vaccinators already trained, and a lot of it goes down to the ground level. This is a lot of work. A lot of it has been in place. Also, to highlight the COVID app, which the government has been talking about, is going to play a very important role. And Vishal, the basis of this COVID app was already there in place in India, which most of the countries do not have. And we are here in India, the government is going to use this platform to implement, to monitor, to even for strategizing the whole vaccination drive, this massive vaccination drive, which is going to kickstart from a few days from now. The COVID software will help the government monitor, keep in check the supplies, the temperature points, the stock details. So, how many vaccines are available at which cold chain point or which public health center, primary health center, hospital, as well as the beneficiary registration can be done through this COVID app. This is an enhancement of an already existing what they call EVIN, electronic vaccination intelligence network. The COVID app is a COVID intelligence network. It's an enhancement of the already existing EVIN system. And this is going to be a huge help. There's a lot of work, I believe, which has gone into it, but still, let's keep our fingers crossed, because in a country like ours, where you have a huge population, you have remote areas, hinterlands, it's difficult to transport the vaccine and get vaccinators, manage the whole show. So we will see.
Okay, definitely. It is indeed a huge challenge, but we have overcome a lot of challenges in the past 8 to 9 months when we talk about the pandemic. And now that we have 2 vaccine candidates whose emergency use has been approved, all that is left is to follow the protocols and start the vaccination rolling. Now, that brings me to Professor Gupta again. And on the COVID app platform, Professor Gupta, as both Mr. Bhaskar as well as Sushmi were pointing out various aspects of it. So for our viewers to understand more about this platform, how will it work, as in who all will have to register themselves in the priority groups as well, and after that also, how will it be used?
See, there are 2-3 very important critical points in that if I am working, if I am a healthcare worker, I am working in a hospital. Now all these hospitals are being asked to register their employees in the category which I just mentioned: healthcare worker, frontline worker, and the third one is the priority sector, where is the age and the comorbid sector. So 1 crore expected, 2 crore expected, and maybe 27 crore expected. So that will be around 30 crores total population.
Okay.
Now this app, which is very already existing and which has been customized and which has been strengthened, but fortunately, as Sushmi has said, this is already existing in the country. So this will be in operation, so that there is a complete control of the entire situation. And there are 2-3 important things is that we do not miss anybody. Some person doesn't lose out, and the people who refuse or who do not take, we also take note of that. And the most importantly is the follow-up, that is AEFI, if any adverse event, that is what the important thing is, to take cognizance of any and each and everybody who is noted. And also, because this has been under clinical trial, so they maybe have to be given by entire note sheet that what could be the possible things which they have to note for possible adverse event, but not to scare them. And that's what they have to be careful. And AEFI is adverse event after immunization. So this system has also been very intensively activated. And as Sushma said, that this type of large operation, yet ensuring zero error possibility, requires huge training. And that's why our health minister, honorable health minister, also said that we had a round of dry run, several dry run in the office and then dry run in practical, and that dry run was primarily to see that if there is any deficiency which can be plugged as of now. So once we get as Shushmi has rightly said, once we get the vaccines from the supplier and it is procured by the government intends to give it free of cost to all those prioritized sector, and then this will be stored at 2 to 8 degrees centigrade, for which the huge number of cold chain equipments are being procured in addition to what already exists. And the backup of that also, the maintenance. So it's a very massive exercise, I would say, with zero error or possible zero error.
Okay, there it is. Massive exercise with a possible zero alert out there. Thank you so much, Professor Gupta, as well as Mr. Bhaskar and Shushmi, for sharing your very, very important views on this important aspect of vaccination protocol. And as our panelists were pointing out, all is set after the emergency use authorization given for 2 vaccine candidates by DCGI. The dry runs have been conducted. The infrastructure is in place. The technical infrastructure is also in place, along with that app which will be used to track all kind of events as well as vaccination. All that is left now is a date to be set. Let's wait and watch, and then the entire process will start moving with the prioritized groups first being given the vaccine, and then the rollout in stages for all of us in the country. Thank you so much for watching Rajya Sabha Television. We'll come back again with a different topic tomorrow. But till then, let me also remind you that please ensure that all of you follow COVID-appropriate behavior. It's a simple 3-step process, that is wearing a mask, washing your hands regularly, and ensuring that you follow physical distancing of 6 feet. This is really, really important for all of us and our dear ones to stay safe. Thank you.